Hello and welcome to my EMS virtual classroom. Today's lecture series is going to be on toxicology. This is going to be a multi-lecture series, and the information that is going to be given in these lectures is going to primarily be coming from Nancy Caroline's Emergency Care in the Streets 8th edition. In part 1 of toxicology, we're going to introduce you to toxicology. We're going to describe the routes of entry, different toxidromes, and assessment. So our goals are to review the important terms associated with toxicology, including defining toxicology, poison, and overdoses. We're going to describe the route of entry of toxic substances. We're going to discuss the major toxidromes. We're going to maintain situational awareness and perform a safe scene size up for patients with suspected toxicologic emergencies. And we're going to perform assessment and management of patients with suspected toxicologic emergencies. So toxicologic emergencies require you to think critically to identify the substances involved. These are the most challenging situations you will face as a paramedic. This is going to help you to determine your differential diagnosis using critical thinking. Also, you're going to formulate your treatment based on the anticipated clinical course of your patient. Cornerstones of pre-hospital emergency medicine include a solid understanding of various substances and medications and a solid understanding of the pharmacokinetics that are involved in the toxicologic emergencies. So some important terms here. Toxicology is simply the study of toxic and poisonous substances. Pharmacokinetics is the activity of drugs in the body over time, including the processes of absorption, distribution, and elimination. Drugs are substances that have some therapeutic effect when given in the appropriate circumstances and in the appropriate dosage. A poison is a substance whose chemical action could damage structures or impair function when introduced into the body. Even a small amount of poison may cause serious symptoms and possible death, depending on the type of poison it is. A toxin is a poison or harmful substance produced by bacteria, venom of animals, or plants. Other terms, licit would be legal, as in a licit drug or a legal prescribed drug. And illicit is illegal, as in a illicit drug or a illegal drug. Excretion, overdose, the outcome of taking a drug in excess. Bioavailability, the percentage of unchanged substance that is present in the systemic circulation. Half-life, the amount of time needed for the average person to metabolize or eliminate 50% of a substance in plasma. Excretion is a removal of a drug from the body. An antidote, something that counteracts the effects of a poison. While we do know some common antidotes, it is very important to note that there are many, many poisons and venoms that do not have antidotes. Toxicology emergencies usually fall under one of two general headings: intentional and unintentional. According to the National Capital Poison Center, 79.4% of all poison exposures reported in 2014 were unintentional. It was also noted that intentional exposures were 32 times more likely to have serious outcomes, such as major or fatal effects, than unintentional exposures. Intentional toxicologic emergencies frequently involve a person who is depressed and may be attempting to die by suicide. The patient may have ingested several different substances, so you need to be thorough in your interview and assessment. EMS providers have also seen an increase in chemical suicides, which we will discuss in one of the future chapters or one of the future lectures of this chapter. This is one of the most important resources that you will have as a provider. The Poison Control Hotline, 1-800-222-1222. There is absolutely no shame in calling this A true professional understands their limitations and understands their knowledge, and this is a very good resource for you to use. I remember that several times when I worked in the hospital, uh, patients would come into the ER and they would have some type of poison or some type of overdose or something. And even the physicians would contact poison control. And when I worked in the ICU as a nurse, I would often get calls on patients that came in with overdose or poisoning by poison control, checking in on the patient and trying to get data. So they're continually updating their data, and so they continually give you information that you do need, and will benefit you in your care of your patient. It is also very important that you document any contact with them and document any reported outcomes in these situations as well. The National Capital Poison Center also has an online tool and mobile device app called Web Poison Control that can be used by lay people or healthcare providers. So let's talk briefly about routes of entry, which are essentially the same routes of entry as any type of medication or any type of allergen or anything like that. So any way that these poisons and other toxic substances can enter the body would be out of entry. So ingestion, you may have immediate damage or delayed effects. Immediate damage, caustic substances that affect the esophagus or the mucosal linings of the mouth and the stomach. Or you may have the effects of delayed digestion where eventually you'll start seeing these. And oftentimes these are going to be CNS effects and things like that. Some poisons must be absorbed into the bloodstream before they can cause damage, and so, of course, you would have to go through the digestion process of that. When responding to toxic substance ingestion, consider all possibilities regarding the substance, whether ingestion was intentional or unintentional. Some of your most common sources include medication around the home and household chemicals. The time a substance remains in the stomach depends on the person. Little absorption occurs in the stomach, which generally provides time for the identification of the substance and treatment. And your management aims to remove or neutralize the poison before it gains access to the intestines. However, it is not standard of care and standard practice to induce vomiting. Some situations you may use activated charcoal, although it is not necessarily used as often now. Inhalation. This is going to be poisoning by inhalation, which may occur when the toxic agent is present in the surrounding environment. You're also at risk. You want to make sure that you have specialized equipment or at the very least mask, such as self-contained breathing apparatus. Responders may require other special precautions as well. Your window for identification and treatment is limited, especially when you think about the fact that you are going to be exposed as well. Injection. Injected poisons usually gain access as a result of stings or bites from insects and animals. However, you can also have issues where you have abuse of IV drugs and things like that. Possibilities for poisoning by injection vary by geographic location. Snake bites and scorpion stings are very prevalent in the southwestern United States. Snake bites are also prevalent in the southeast as well. Jellyfish, such as and the Portuguese man-of-war sea urchins and anemone stings are prevalent in the coastal areas. Wasp, yellow jacket, and hornet stings are common throughout the United States as well. Some poisons are neurotoxic, while others produce localized or systemic reactions. When a bite or sting hits a vein or artery, the toxin immediately enters into the bloodstream, and depending on the potency of the toxin, the patient that depends on the effects. Always look for the localized findings, but be aware of the potential for the neurotoxic or the systemic findings as well. And then absorption, this is going to be a longer route of onset. This is going to be primarily poisonings by pesticides and other types of poisons that may come into contact with the skin. The big thing here is going to be decontamination, and also understanding that this may be a little bigger than just your two-person team on the ambulance. This may actually be a hazmat situation, so it is very, very, very important that you identify the substance. So what is a toxidrome? A toxidrome is a toxic syndrome, which is a syndrome-like symptoms of a class or group of similar poisonous agents. This is very useful for remembering the assessment and management of different substances in the same group. There's 5 major toxidromes. However, these are all of the toxidromes, but your 5 major ones will include narcotics, sympathomimetics, sedative hypnotics, cholinergics, and anticholinergics. Often a working diagnosis can be developed by looking at their history and their physical findings and their vital signs. You can also find this chart on page 1404 of Caroline's Emergency Care in the Streets, Volume 1. Your narcotics include, but are not limited to, morphine, codeine, heroin, methadone, opium, hydromorphone, fentanyl, oxycodone. What will you see in these patients that have been exposed to these types of drugs in this toxidrome? CNS depression, hypoventilation, even respiratory arrest. Now, it is important to remember when you're assessing pupils with narcotics, you're going to see constricted or pinpoint pupils. However, with sympathomimetics, such as methamphetamines or cocaine, you're going to actually see dilated pupils. Now, what else would you see with your sympathomimetic exposure? Exaggerated sympathetic response, hypertension, diaphoresis, tachycardia, tachypnea. What about your sedative hypnotics? These include your phenobarbital, diazepam, thiopental, midazolam, several of your benzodiazepines, propofol, anything that puts you to essentially asleep, or anything that also has the hypnotic effects as well. Again, you're going to see some central nervous system effects, hypoventilation, respiratory arrest, drowsiness, disinhibition, ataxia, and the list goes on. What about your cholinergics? These are going to include organophosphates and different types of nerve agents as well. Remember this: dumbbells, diarrhea, urination, which is constriction of the pupils, muscle weakness, bradycardia, bronchospasm, bronchorrhea, which is going to be discharge of mucus from the lungs, emesis, lacrimation, seizures, salivation, sweating, respiratory depression, apnea, coma. Tachycardia can occur early, with bradycardia developing as toxicity progresses. Another way to help you remember this is going to be sludgeums, salivation, lacrimation, urination, gastric distress, defecation, and emesis. Then your anticholinergics, this is going to include your atropine, scopolamine, antihistamines, diphenhydramine, TCAs or tricyclic antidepressants, psychotics, and even Jimson weed. See agitation, dry mucous membranes, flushed skin, hyperthermia, tachycardia, dilated pupils, blurred vision, mild hallucinations, dramatic delirium. So this is just a quick overview of substance abuse. Substance abuse often results in a lot of social stigma in addition to the physical effects. It needs to be noted, though, that not every person that is struggling with substance abuse is your typical drug abuse profile or your alcoholic profile. Anybody around you could be struggling with this, and so stigmas and stereotypes are not very useful in these situations at all. There's a wide and growing variety of substances which are in use today. The definition of substance abuse differs among cultures, but essentially the definition of drug abuse or substance abuse is going to be any use of a drug that causes physical, psychological, economic, legal, or social harm to the user or others affected by the user's behavior. A couple of other terms here with substance abuse. You've got habituation, which is psychological dependence on a drug or drugs. A physical dependence, which is a physiological state of adaptation. The body has gotten used to that drug and actually needs it, and the patient has developed a physical dependence. You will often see drug withdrawal symptoms if the drug is stopped abruptly. Tolerance is going to be a physiological adaptation to the effects of the drug, such that increasingly larger doses of the drug are required to achieve the same effect. This is often the reason why patients have accidental overdose, because they just simply cannot get high off of the original amounts that they were taking, and so they need more and more each time that they get high. Withdrawal syndrome is a predictable set of signs and symptoms, usually involving altered central nervous system activity, that occurs after the abrupt cessation of a drug or after a rapid decrease in the usual dosage of a drug. Drug addiction, a chronic disorder characterized by the compulsive use of substance that results in physical, psychological, economic, legal, or social harm to the user. The user continues to use the substance despite the harm. An antagonist is a molecule that blocks the ability of a given chemical to bind to its receptor, preventing a biological response. Potentiation is the enhancement of the effect of one drug by another drug. And synergism is the action of two substances, such as drugs, in which the total effects are greater than the sum of the independent effects of the two substances. So moving on into your patient assessment, the general assessment approach is the same for all patients. Scene size up, primary survey, history taken, secondary assessment, and reassessment. If the mental status is altered, then diligently monitor the patient's airway and breathing to ensure he or she does not aspirate and has adequate minute ventilation. You need to ensure a good overall clinical picture of the patient. You need to determine very quickly what the patient has possibly been exposed to. Patients with toxicological emergencies may also have sustained traumatic injuries depending on what they've been exposed to. Your scene safety is going to be paramount in these situations. Even if it's a situation where the patient's ingested something, you need to make sure that you are paying attention to all situations, including family members, not just potential exposures to the drug or the substance itself, but the psychological or the anxiety states of the family members and things like that. Look for clues such as pill bottles, household cleaners, or handwritten notes. Patients who have taken an overdose may be dangerous depending on what they've been exposed to. It is very, very important that you call for law enforcement or a crisis unit if necessary. So these are just some examples of the different types of illicit drugs: methamphetamine, cocaine, bath salts, synthetic cannabinoids, ecstasy, and marijuana. It's going to be important that you're able to identify these types of drugs. Even if you don't have an extensive history with these types of drugs, it's going to be very important that you at least have an awareness of them. Identify your mechanism of injury or your nature of illness very quickly. Determine the severity and set the priorities. By the end of your primary survey, you should be able to determine these, and you should determine what are the situations in my scene and what are the things that I need to be paying particular attention to. Toxicologic emergencies involve symptomatic patients, so elaborate on the chief complaint using your different types of mnemonics, but also think just past mnemonics and actually think about the questions that you need to ask. A couple of very important ones, obviously. What is the substance? What did you take? How long ago was it ingested, injected, absorbed, or inhaled? In almost all cases, the dosage of the toxin is directly proportional to its toxic effects on the body. Also ask what else was taken, because again, you've got the effects of potentiation and synergism. If they've taken something else, such as alcohol with a benzo, then the effects are going to be even more. Has the patient vomited or aspirated? Are they able to contain their airway? Also, it's important to find out, why was the substance taken? Was this an accident or was this intentional? Because that could change the way you treat the patient as far as care goes. But again, we're going to remain non-judgmental. Ask this of every patient. Do not make assumptions, and put the answer in quotation marks on the patient care report if it is a direct quote. Now, in most situations, toxicologic emergencies are often medical emergencies only. Patients may have alterations in mental status and be prone to nausea and vomiting. Be sure that you are still protecting yourself. If there is a trauma, then of course you're going to have to complete your trauma assessment as well. In an unintentional overdose or poisoning, an older adult patient may have become confused about his or her drug regimen. So this is going to be important. May have accidentally forgotten they had taken their medicine. They may have taken too much. They may have not have taken their medicine at all. Now, in pediatric patients, if they're in stable condition and has a history of a single small ingestion of a low-risk agent, then some EMS systems allow the transport to be canceled after agreement from medical control. I would not agree to cancel any transport until you have talked to medical control. And then, of course, we always want to reassess, understanding that all patients are dynamic, especially patients that have overdosed.